Today's episode is powered by Listen, a groundbreaking AI platform transforming how child welfare and other public sector providers learn and grow. Imagine being able to roll out comprehensive, secure training and quality monitoring across your entire organization instantly. That's exactly what Listen delivers to over 70 public and private sector clients. Developed by PhD academic psychologists, Listen helps health and human services agencies master motivational interviewing and other evidence-based practices. And this isn't just another training tool. It's backed by 16 years of rigorous research and peer-reviewed studies. To learn more, visit listen.io. That's lyssn.io. lyssn.io, or follow the link in the show notes.
Hello and welcome to the Imprint Weekly Podcast. I'm John Kelley, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. Check out our show page and all of Safe Camp's other great podcasts at safecampaudio.org on the web or at Safe Camp Audio on social media. On today's episode, we are joined by Kelley Fong, an assistant professor of sociology at the University of California, Irvine, who studies the impact of state child welfare systems and their policies on families. Now, I first met Dr. Fong virtually when she released some findings in 2020 about her really quite novel embedded project with Connecticut's Department of Children and Families. I convinced her to write an opinion piece for the Imprint laying out the main findings of that work. I'll link to that in our show notes. Just a snippet from that op-ed real quick so you get a gist of her findings, and I'm quoting her here from her op-ed. I saw firsthand how calling CPS has become a crutch for well-intentioned teachers, doctors, and even police officers who struggle to address challenges like homelessness, domestic violence, mental health needs, and substance misuse. Now, since then, Fong has authored and published Investigating Families, which is a book that draws on her Connecticut experience, but also on research in other New England states, as well as some critical national context. So we discussed her work in Connecticut, some parts of her book that really jumped out to me reading it, and much more. Fong and I recorded this over the summer in 2024, so I apologize for any dated references in it, but I'm happy to finally get this one out there because it really was a great conversation. So without further ado, here is our interview with Kelley Fong. All right, we are joined today by Assistant Professor of Sociology at the University of California, Irvine, and author of Investigating Families, Motherhood, and the Shadow of Child Protective Services, Kelley Fong. I hope you take this as a compliment, Kelley. I view this book as a work of journalism. You read it and you can see it involves tons of interviews with parents, with family members, with line workers at CPS, with experts and her fellow researchers, even agency leadership. So I'm getting ahead of myself. Welcome, Kelley, to the Imprint Weekly Podcast.
Thank you so much. It's wonderful to be here.
We'll talk about the book in a second. House rules here on the podcast. Before we get into the weighty stuff, we got to give these folks a favorite. Here are your categories: TV show or movie, book, musical group, or sports team. You have to give me one. You can give me more than one. If you want to just spray 5 recommendations out, folks, feel free. What do you got for us?
Okay, great. So yes, I get to plug my favorite TV show, which is Survivor. Yes, it's still on the air. It's so fantastic. There's a couple seasons on Netflix that I highly recommend people check out if they are interested. I think we're up to season 46 now. And I am such a Survivor super fan. This honestly got me through the fieldwork when I was in Connecticut. I was driving constantly and listening to 12 to 14 hours of Survivor podcasts each week. I apologize. I couldn't be listening to the Imprint podcast.
Okay, it's okay.
Too close to home. It was my way to kind of disconnect and dissociate.
No problem at all. I totally understand that. Are you saying you've been like Survivor start to finish?
So a lot of folks got into it during the pandemic when seasons started getting put on Netflix. I got
Right.
into it maybe about halfway through. So at this point, maybe 10 or so years ago. And it's really evolved since its earlier days. They've put in a lot of bells and whistles. And fundamentally, it's still this kind of interesting social experiment where they put a whole bunch of people on an island together and see what happens.
Amazing. I look forward to the journal article you write someday, contrasting Survivor to child welfare.
That's like the dream, right?
The pinnacle of your career.
Yeah, this 10-year project.
Yeah. So I think I first came to know you when I don't know how your report on your time in Connecticut made it to me, but I read the thing and I just was like blown away by it. You basically like spent some time embedded with Connecticut's child welfare system, which ends up being kind of a linchpin part of the book. And you were kind enough to pen an op-ed reflecting on that experience for us, which I will post a link to for folks that want to read that. It'll be in our show notes. But I guess I want to start today talking about your book with just like the origins of the access and like the arrangements you had with these guys, because I think it'll maybe be interesting to folks listening to this. Can you talk about how you put that experience in Connecticut together? It kind of struck me as like novel research on one level, and then I also felt like it was surprising for a state to agree to that kind of arrangement. So how did that come about?
Yeah, it's really a story of being in the right place at the right time with the right people. So in that sense, I consider myself just sort of very lucky. On the other hand, it is a story, I think, of persistence and a story of agencies being willing to be open and interested in learning from stakeholders, including researchers. And so I first was in touch with Connecticut my first year of grad school. So this is like 4 or 5 years before the Connecticut fieldwork actually started. And I had sent out through a contact an inquiry to all of the New England child welfare agencies saying, hey, I'm interested in, understanding the spatial concentration of CPS reports. Is there any agency that's interested in working with me on this? And Connecticut was one of two that responded. And so I did this whole thing with them where I spent hours and hours and hours in a cubicle in Hartford, kind of working through their data, and through that kind of got to know their research and evaluation folks, and was invited to present that to the commissioner and her senior administrative team, invited folks there in the room if they wanted something tailored to their region to reach out. And a couple of those regional directors did. So at the same time, I had been interviewing mothers in Providence in Rhode Island and had been getting really involved in sort of going to child welfare court there, and really thought, hoped that I would be able to get access to Rhode Island DCYF. Pursued that. It's a sort of longer story that's told at the end of the book in the appendix, but, it didn't work out for whatever reason. They were navigating a number of tragedies at the time under a lot of scrutiny. And similar with Massachusetts, I actually approached Massachusetts and they were dealing with a lot, reconfiguring all of their policies, and just said, now is not the time. So I reached out to Connecticut, starting with one of the regional directors whom I'd given a presentation to, and they were very open from the start. They said, yes, we would love to sort of figure this out with you. Of course, it's not just that one person who has to agree. The agency has a research review board where a lot of concerns surfaced, concerns were raised, but ultimately they, came to understand how research participants' personal information would be protected and that kind of thing. And we're willing, again, to be open to learning from researchers. I think the research and evaluation division was very supportive, again, because they had worked with me and had seen that it wasn't going to be someone trying to, muck rake or, throw everybody under the bus.
Yeah, it's like that does kind of come through. It's like, and so it's interesting hearing you reflect on this from the other states. It's almost like Connecticut must have felt good enough about its process or its own general structure to say, okay, she's probably going to surface some things that won't be comfortable for us to hear, but we feel good enough about baseline how we operate that we're unafraid to do that. Where states that are reconfiguring, that might be like that. I guess that was too kind of nerve-wracking for them to have you.
I think that's exactly right. In many ways, I think Connecticut is really a best case scenario. They were proud of what they were doing. I think they knew that, of course, like all agencies, there's opportunities to improve, but they were genuinely interested in understanding the perspectives of people who were directly involved with their system and saw this as an opportunity to learn more about that.
Before we get into any kind of specifics here, why don't you take the listeners here through sort of how this book flows, like from start to finish, what aspects of CPS are they going to learn about in investigating families?
So from the title, the book primarily focuses on investigations on the front end. So before I really started this work, sometimes equated the child welfare system with foster care. But foster care is actually a small portion of the families that the system touches. And so most of the book really dives into the experiences of families that have sort of these maybe one-off or like deflected contacts where their cases are ultimately closed after investigation. And sometimes it's easy for us to look at those cases and say, well, this is wonderful. CPS got in and got out, no harm, no foul. The family can just go on living its life. But the book looks at the experiences of those families as well as families who haven't even had contact with the system at all, but are, living and raising children in environments where CPS intervention is the norm, to understand sort of what this experience is like. And so I start in the book with a chapter on the experiences of parents or the perspectives of parents on child protective services broadly, whether or not they have had encounters with the agency, and the way that CPS's high presence in their communities and social networks really shapes their parenting in profound ways. The next chapter gets into the perspectives of mandated reporters, so professionals like doctors and teachers and police officers who are filing, the vast majority of reports, to show how it's not just the situations of families that are driving reports. It's not kind of this one-to-one automatic, child potentially maltreated report happens, but that it is about the social context, the aspirations of reporters, the conditions that reporters are working under, the biases that they have that really turn these situations of, what I think of as family adversity into reports of child maltreatment. The next 3 chapters get into the experiences of families under investigation and what that investigation means and what it means to have this response to adversity that's funneled through an agency like CPS that is empowered to remove children and that is organized around things parents are doing wrong, right? Abuse or neglect. So it goes through the fear that parents feel, the absolute terror that CPS might be coming to take their kids, the surveillance that is involved in these investigations. CPS is sort of really digging into all aspects of family life, by design. The focus on risk in particular in CPS investigations and the way that caseworkers are trying to make predictions about the future based on the needs that families have in the present, which essentially sort of sets the families with the greatest needs up for additional CPS oversight and monitoring. And then the help or the lack thereof, or the type of help that CPS is ultimately able to offer. And specifically, because it's an agency that's focused on child abuse and neglect rather than, ameliorating poverty, what they have on offer is therapy, essentially. Therapy with strings attached, with the threat always looming that, if you don't cooperate in the way that we want, CPS will be able to take your kids from your custody. And then the final empirical chapter does dig into the experiences of families who are going to court, who have their children removed. And that primarily draws on the Rhode Island data, where I met a number of mothers in this situation, and just the profound, like devastation, certainly, of this experience, as well as the demobilization that this engenders in the sense of, parents coming to see really where they fit in with respect to the state and really their position in society. They often came out of this experience feeling quite defeated.
There's a lot of great passages and great chapters and great lines in this. There were 2 that, I sort of jotted down as I read as really standout conceptualizations from your work and your observations. One is that CPS uses the dual embrace of care and coercion, and that its workers are first responders of last resort, which I think the common thread with both of those is they kind of imply a duality, right? Can you talk a little bit about what you mean by both of those? The dual embrace of care and coercion, and that workers are first responders of last resort.
So I think that the dualities that you mentioned are really central to everything that happens within CPS. Because on the one hand, they are the system, sort of as you alluded to, that is in theory about providing supports to families. They do offer service referrals and many things that parents do appreciate. A sensible goal is to, promote the well-being of children and families. At the same time, they have this tool, right? The tool of being able to take a family to court and forcibly separate families that, can't be ignored, and that when they come to the door really looms large for families in all of their interactions. And so you can have a social worker, a caseworker coming to the door, as many did in Connecticut. Again, I think this was really a best case scenario. They're coming in, they're very friendly, they're often quite respectful and professional. And mothers in cases that closed told me that they experienced the investigator that way. At the same time, as nice as this person is, and as many, service referrals that they can make, they also have this really kind of this stick or this hammer that clouds everything else, right? And so I think that makes it hard sometimes for parents to take up some of the services that CPS is recommending. Or maybe they do take the services up, but they feel coerced into doing so. The worker may frame it as voluntary, but the parent understands, this is maybe a way that you can kind of, if I participate in this, you can close the case and kind of get out of my life. And so I think that duality really structures everything that happens. And it also structures all of the reports that come in, right? So the vast majority of reports that come in, CPS goes out and investigates and ultimately doesn't find sufficient evidence to substantiate. And when I spoke with mandated reporters, one of the things that surprised me was that they didn't necessarily see the children that they were reporting as in grave, imminent danger. They didn't think that kids necessarily needed to be removed right away from unsafe households, but they saw this kind of dual care and coercion piece as appealing, right? Here's an agency that can connect families to supports at the same time, if parents are not kind of in line with what we would like them to be doing, they also have this stick that can kind of get parents, and particularly poor parents and parents of color, in line.
You had already done some research on child welfare practice and policy before you started down the road. Although I did find it interesting in your kind of narrative of how you put the research together, that it was like to your advantage that you kind of presented as like a young college student, right? To some people.
Yes, absolutely.
Way more likely to trust you than some like old grizzled journalist or researcher, I guess. But you had done some work and some exploration in this. So no doubt you had, your own viewpoints already as you're starting about this work. But what would you say, big picture, you came to learn, and maybe what perspective changed for you as a result of all this work that went into producing this book?
Yeah, I would say two things. One is that I thought there would be substantial disagreement in the way that these different parties understood the situations that families were facing. So between the parents, the reporting professionals, and the caseworkers, I thought that parents would articulate, an understanding of the situation that was rooted in sort of their social conditions, right? Poverty, domestic violence, addiction, and so on. And that the social workers and mandated reporters would be very quick to blame the parent and sort of call them, sort of bad, quote unquote, bad parents. And certainly we see some of that, and absolutely, especially once cases move past that investigation stage. So what I'm saying is really focused on the investigation stage here. But I actually found a lot more kind of concordance on this than I anticipated. So I was surprised to hear that, mandated reporters didn't think that kids needed to be removed. And I was surprised to hear that caseworkers would get these reports from reporters and say, like, why did this come to us? This shouldn't be something that we're involved with. Why are we getting all of these BS cases where the reporter could have just asked one more question and saved the family all this grief and saved us all of this work of, because for every single case, they're going out every other week. They're doing all of this document review. It's a whole lot of work that comes up. And so it struck me as an opportunity, I think, to leverage that kind of understanding that CPS might be involved in many more families than those that, folks think have serious safety concerns, and a real opportunity to kind of think about how to walk those back and get those families potentially routed, to more explicitly supportive supports. The second thing I think I learned, which I sort of allude to at the end of the book, is that when I started, I was really very focused on the child welfare system. And, I thought that this would be, it is a book about the child welfare system, but I thought that primarily what I would have to recommend at the end are things that the child welfare system should be doing differently, could be doing differently to improve conditions for families. And certainly there is some of that, but, I really came to see how much broader than this system child welfare really is. So one thing that administrators actually in both Connecticut and Rhode Island would say is, we are the child welfare agency. We are not the child welfare system. So, they can really do a small portion of child welfare work. They're tasked with doing a small portion of this child welfare work, right? Safe, significant, imminent safety concerns. But there's a whole lot of other aspects of society that need to step up and we need to invest in to actually do the work of child welfare. And so if I had to, say one thing, right, that should change, it's not something in child welfare, it's something in the rest of society.
And it's like, I've not really put it together like this till you just laid it out there, but like it almost is like one of the sort of conundrums here is that like reporters view the like child welfare conceptually as the broader thing that the agency is not. And so they report on all the things that might be helped along that continuum, when in fact the workers, the workforce, the agency is kind of just, its writ is much smaller. And that is a conflict. Did you get the sense interviewing reporters, and by that we mean school people, like people at schools, cops, medical workers, all that, did they know that the perception on the other end of those calls is that they are foisting unnecessary cases into that system? Or do they think they're doing a good thing and people are grateful that they are doing that?
I think the latter, and this is where, I'm not going to let the agency off the hook too much. I think that there is this disconnect. So that is the experience. What I've described is the experience of frontline workers and maybe hotline call takers. But it's, at least at the time that I was doing research, mandated reporters are getting a lot of mixed messages where administrators from the agency are telling the press, like, call everything in. We would rather have you call it in and not be sure, and really encouraging sort of this wide net of calls. And so I think this reflects kind of, on the one hand, this is coming to us and we recognize that it might not be a good fit for what we actually can do. At the same time, I think there's this reluctance among folks in the agency to let some of these cases go for a couple of reasons. One, as people that are concerned about children's welfare and child safety, like, where else will folks send these families, right? When you send the family to CPS, you can be assured, if the case gets screened in, that someone will go out to the home and try and speak with the family. And so if they're turning those cases away, is there any kind of alternative where someone is going to check in with a family? Maybe not. And then the second, maybe a little bit more cynical take is, right, they sort of become liable for cases that they know about and decide to deflect. And so if they, it can be on the call taking side, the risk averse decision can just be to screen things in, check it out, just in case, something terrible happens and we decided on the front end that, this wasn't something that required our attention.
Yeah, there was a particular scene in the book. That's why it sounds weird to say. There's a scene in the book, like the movie, that you describe where there's a child who has tested positive for drugs. And it's pretty clear in your kind of telling of this that, the line worker and the supervisor both kind of feel the circumstances do not warrant any sort of like further action. The mom had a marijuana card. She was pretty open about the fact that she, pretty infrequently had used some drugs, or had used marijuana only. But then, the supervisor says, but we should still do it. And literally says, like, in front of you, CYA, or cover your ass. Was your sense, like, what was your sense of how much that mentality propelled cases as a ratio, in ratio with like genuine concern propelling cases down the line?
I think it's both. So there is this concern about liability. At the same time, and that is real, right? When I was there, caseworkers were, especially in Rhode Island, caseworkers were in the news for, not doing absolutely everything to track down everything under the sun. caseworkers in Connecticut knew folks who had, been, I don't know if terminated, but at least reprimanded. Certainly, there were frequent reviews. Sort of, this is what they're held accountable for. There were reviews where, I think I was invited to participate in one of these, where people in the agency will select a random group of investigative cases and say, did they speak with the child alone and separate? Did they do the criminal records check? Did they do? That's what they're evaluated on. At the same time, I think that the ethos of child welfare nowadays is really focused on prevention, on early intervention, on doing this kind of holistic needs assessment of families to hopefully keep them from coming back to CPS, or also keep severe maltreatment from occurring, hopefully. And so, if you have a report come in for, say, a child has many absences at school, this mentality means that it's not just the investigator's job to say, okay, like, what's the deal with attendances? Let's try and fix this problem. All right, you got it worked out. Okay, bye. It's also an opportunity for prevention. And so when it's an opportunity for prevention, they want to be asking families like, hey, tell us, have you been experiencing domestic violence? Does anyone in this household use substances? Tell me about how you discipline your kids. Sort of really doing this broad, holistic, in one frame, a needs assessment, but in CPS's, when it comes to CPS, it's really a risk assessment. And so sometimes that surfaces things that the agency will want to get involved in further. And so I think it's kind of both this liability fear, but also this, I don't know if it's genuine, but this desire to see what it might be that families could benefit from and to try and do that outreach, even if that's not the precipitating cause.
Yeah. And that really kind of that's one of the more interesting parts of the book is just you get a real sense for, I don't know, this kind of tipping point where, as you said, a lot of times it doesn't even get to the point of investigation. They screen stuff out, right? When reports come in. And then all of the things that get investigated, a lot of that stuff, it really doesn't move past that. But if you get past that point, then it's we need to know everything about you and everybody that's around you and everything.
Well, and it happens in the investigation. That's what the investigation is. And I remember writing this in notes even after the first maybe week of informal shadowing, even, right? That this agency, getting the report is really like writing the state a blank check. It's saying you can go in now and ask whatever you want, get any kind of information you want. So the report could be totally bogus. It could be about some narrow issue, but once that report comes in, the floodgates open. And now the agency is potentially in every aspect of your life. Again, justified by these ideas that this is sort of a preventive early intervention type approach.
Caseworkers are stretched thin, balancing high caseloads and endless paperwork. But with SpeakRight, documentation doesn't have to mean burnout. SpeakRight's Protective Services transcription cuts paperwork time dramatically, so you can meet deadlines, reduce overtime, and focus on what truly matters, the families you serve. With SpeakRight's free mobile app and desktop platform, caseworkers can capture detailed narratives anytime, anywhere, with just one tap to upload. SpeakRight is proven to lower stress and turnover, helping agencies retain dedicated staff while improving case quality. Don't let documentation slow you down. Let SpeakRight do the heavy lifting. Visit speakright.com/imprint to see how SpeakRight can transform your agency today. That's SpeakRight, SpeakWrite.com/imprint.
You start the book, I think, smartly by not starting necessarily with a process, but with a full chapter really about how communities perceive CPS. It sets the table for everything that comes after it. So that's the community's perception of that. I was curious what your takeaway from so much, in-depth interviewing of workers in these two states, what their perception of their identity is in the public. How do they feel they're perceived?
So I think they understand the fear that they instill. They are doing this work every day. And so they understand that when they knock on the door, it has a certain connotation, and that folks are, understandably pretty terrified. And so I saw a lot of instances where workers would kind of put parents' reactions in that light, right? Oh, well, she probably just, didn't want to do XYZ or was cagey about ABC because, this is her first time and she's really scared. So putting it in that context, I think they do understand. And I think at the same time, their kind of takeaway from these interactions, and even when I would present early versions of this research to them, was, well, what we have to do then is educate communities about the work that we do, right? We need to educate communities that we're not just in the business of removing children, that actually we have all of these additional supports. We're really here to help you. And we need to sort of break down that stereotype of, here we are, we're just here to snatch your kids. And I think that that's a little bit, it misunderstands a little bit the power that these workers have, regardless of how often they actually end up wielding it. The fact that it is a possibility, the fact that they have this authority to begin with, I think it's no amount of sort of papering over that with like, but look at all of the other wonderful things we can do and we're just here to help, I think really takes that away. And so I think that there almost isn't a way for CPS to kind of rebrand itself as fully a helper in impacted communities, so long as, a key part of what it does, in fact, the thing that it alone does is separate families.
The CYA incident was one of the ones I want to kind of reflect on with you. There were two others that I kind of jotted down that I thought spoke to some bigger things that were kind of interesting in the broader child welfare context. One was a situation where there was I think a relatively young mom. And again, it seemed like a case where you're describing unlikely to move past the investigation phase, but they wanted to talk to her kids. She was really hesitant to do that. And you kind of you describe this scene where, she's the supervisor is kind of like urging the caseworker, like, no, we got to do this, like bring it up again. And it almost felt like the worker would have been like fine to leave it alone, but she brings it back up. And the mom says, what if I say no? Like, I kind of want to, I think her words are like, I kind of want to bluff it. I'm not sure exactly what she meant by that. That was but like, what if I say no? And I just thought that's, that was a really poignant scene in the context of we're seeing a lot of discussion now about how much and how to convey to parents at the front door, what their rights are at various points along the way in terms of investigations and letting people in and letting them talk to your kids and letting them look around your house and things like that. I just felt like that scene really spoke to kind of this broader thing. And in this case, in this situation, the caseworker almost kind of like pretended not to hear it, right? And got a blitz by it, which is super awkward, right? Like, so what, I mean, did you observe that happening a lot where they're, just sort of choosing not to be candid?
I think that they get a lot of their sort of power through this kind of shadowy authority, I guess, right? Where parents don't always know exactly what they can or will do in any kind of specific situation. And CPS can really leverage that to its advantage, because it may be that, if a parent said no, CPS might not feel it had the evidence to move forward with anything. And I did see that happen in a few instances where parents declined and CPS said, well, okay, I don't think we have enough to push this forward. But they don't want to make that, they don't make that clear to parents because they want to get all of the information they can. And honestly, it makes investigators' jobs easier, right? When they don't have to sort of bring things up the line to supervisors and managers and get sign off, what else do I need to do? Do I need to keep visiting? Do I need to show up at this time? Do I need to escalate this? It's so much easier for investigators' own work routines if parents just open up and cooperate. And so caseworkers really can leverage that and leverage parents who don't know exactly what will happen to kind of smooth these interactions in ways that kind of open up families and their personal lives to the system.
I mean, the right answer there would have been to say, you have the right to refuse to expose your kids to me to have this conversation right now. But I should also let you know that, my supervisor was pretty insistent on this, and I can't promise you that he won't decide we need to pursue some sort of court action to compel that, right? Like, she
That's
probably should have
exactly right.
said that. Yeah.
Exactly right.
I think the other interesting thing about that scenario is, like, as you know, Connecticut is in some way a little bit ahead of like where I think a lot of states are going to end up, because there's this kind of nascent movement around like the concept of family Miranda. Texas passed legislation where they're giving like a verbal notice of rights, or they're supposed to be. Anytime there's an investigation, you have the right to not let us in. You have the right to this and that. New York, legislation's been kind of not introduced, but it has not moved in several years now. But Connecticut kind of low key just did this a while back, but written, right? They just have it in writing. I was at a meeting with a bunch of lawyers talking about the family Miranda stuff, and there was an attorney who was like, "I don't really feel like this has had any impact at all." Was that your takeaway too? That like this delivery of that written notice, obviously in this case, the mom did not. I mean, she still had questions, so it didn't alleviate. I don't know if she got that written warning or not, but it didn't edify her on everything that she could have considered there. But
Yeah, no, I agree. I think this kind of notice feels very straightforward to me, like a bare minimum thing that we should be doing. It doesn't seem too controversial to me. I think that in terms of impact, it's all in the implementation. And so this is what I've tried to convey to folks in New York and elsewhere, that, you can have this on the books, and then it all depends on how the agency decides to roll it out and how caseworkers introduce it. So I agree. I think it really had, I really didn't see parents decline to speak with caseworkers after seeing the notice, maybe, one or two times, can
yeah,
count on one hand, like almost always parents open up, because, if you don't, that you're sort of in this rock and a hard place situation, because if you don't, then all the agency has to go on is the report about you where somebody has made some sort of allegations of maltreatment. And so many parents told me that, they wanted to have the caseworker in, they wanted to answer their questions so that they could share their perspective, their side of the story, and explain what was happening. I think that in terms of implementation in Connecticut, again, it's this brochure. It's like been mimeographed so many times that like the type is really small and like blurry. Workers don't necessarily go through it point by point. They don't necessarily do it at the start of the visit, right? Because when you knock on the door, often the parent wants to know, why are you here? And so they want to sort of get to that first.
never really thought about how awkward it would be to knock on the door and then somebody ask like, "What's this about?" And it's like, before I can tell you, ma'am, please read the entirety of this placard
Yeah.
before we speak. Yeah, that's a challenge with written material.
Yeah. And, even like you said, the caseworker in that one case's truth would be, right? The truth is that if you don't let CPS in, they do have these alternate measures that they can call on if they feel it's necessary. And so in trainings, the trainers would emphasize, it's important for you to make clear to parents what are the consequences, the potential consequences if they decline. And so that framed the way that workers introduce these brochures. They would say things like, you do have this right, but it's easier for all of us if you cooperate. Those kinds of frames that really set up parents who are trying to avoid escalation to just acquiesce and let the agency in.
Right. The other kind of scene from the book that I thought kind of really jumped out was an interaction between CPS and a mom named Zenobia and her child Rashid, which you described as a rare instance where the parents sought out CPS. I want to set that part aside because I actually think it was more just the nature of the interaction or the nature of the call that I think is something that's current today. And this is a case where her son was exhibiting kind of like an escalating pattern of pretty dangerous behavior. And I think that that's one thing about the Family First Prevention Services Act, which was passed, more than 5 years ago now, 2018, was meant to, on one hand, kind of provide federal funding for more efforts to prevent foster care. It rode in on the coattails of like, we need to do something about the opioid epidemic.
Mhm.
So substance abuse for parents, and then also parenting support and mental health services and stuff like that. But what you really see, like in the stuff that's getting approved for funding, it's a lot of child behavioral health. I think you set that scene as sort of like this happens too, where parents come to seek help. But I'm more interested in, did you see that as like the nature of requests, whether or interventions with CPS, whether it was involuntary or voluntary, where really at the heart of the case, we're not talking about parental neglect or abuse. We're talking about children's behavior and the parents' fear of managing it or inability to manage it. Did you see that as like a very present situation?
Yeah, it did come up in a number of cases that I observed, and the research that I did in Connecticut, largely predates the implementation of Family First. And so this is a case, as you mentioned, where the sort of preteen, young teen son is exhibiting these behavioral challenges. A mom feels like she can't manage them, and CPS investigates, but feels like, this is not abuse or neglect. We can't really do anything. You can call for voluntary services, but we're going to close the case. And she sort of wants more support from CPS that they can't provide given their sort of relatively narrow focus. And so I had colleagues, for instance, in New York City, read this draft. And on that case, they said, this is so strange. This is a clear case for preventive services in New York City, right? New York City offers this sort of array of preventive services where families can get connected with sort of contracted private agencies to get that kind of support. And so I don't know, with Family First increasing funding for those kinds of efforts, if this situation would have been handled differently, say today, post Family First implementation. And I remember in both Rhode Island and Connecticut, when I was doing this field work, there were certain children's behavioral health services that you could only get with a CPS case, right?
Yeah.
That was just the way to do the funding for it. And so in both states, I saw these examples of parents who said, yeah, we don't really understand. Like, they just told us that the case is just open for the funding. It's not open because of abuse or neglect, but they have to do it this way to get funding. And at the very end of the book process, I fact checked that with Connecticut. And I said, is it still the case that, there are some behavioral health services that you can only get with a CPS case? And the response was that, there used to be, but this has changed. And so they are creating these beyond CPS pathways to those services, which I take as a really good.
That was sort of surreal in the outcome of just that case with Zenobia and her son. The child ends up he's hospitalized briefly and then goes to a residential program, right? But that's described by her and CPS, I think, in the book as like, oh, we avoided foster care. She was worried that if he went to a foster home, that would be a mark on her for life, which I think is a rational concern. But you step back for a minute and you're like, I mean, he went to like a congregate care facility. It's like, maybe it would have been more appropriate, but this is something that states are grappling with. Medicaid, like Ohio had to kind of like redo its whole Medicaid approach to young teenagers because they were just in a place where they were like urging parents to surrender their kids to foster care to get mental health interventions. It's like, that's wild. You can't, no one really wants that,
Yeah, well, and that's the thing I think that made it different in the mother's mind is, this residential option, she retained custody. She retained
right.
So it could be up to her in the future when he had sort of completed the program, what happens. And I think for most parents, the prospect of foster care is especially terrifying because you're not in control, right? If you sort of allow or sort of, I don't love the word surrender, but if you sort of acquiesce to the foster care option for your child, you're giving up a lot of control and autonomy. And you're basically saying, I might be in a place in 6 months, in a year where I feel ready to, parent this child safely. But at that point, you're not in charge. The state that is. And so that's a really terrifying prospect.
So I had to wrap up mostly talking about some of what you say in your conclusion, which I really felt gets to the conundrum that this system is so often. I'm just going to read a very quick part of it. To the extent that children in affluent white areas experience less harm, it's not because their parents care more about them, but rather because their parents have the family and community resources to raise their children in the ways they want. Clearly, increasing support for labor rights, the cash assistance, safety net, housing, food, childcare, healthcare, transportation, and other material needs is essential, as is investing equitably in libraries, parks, and other public spaces. All of this, improving the conditions under which families and communities raise children, is child protection work. And, I just think that really nicely gets to the conundrum that those are clearly protective factors for children. Everybody knows that, and the research is kind of catching up to what we anecdotally believe, just
Mhm.
not like a straight up question. Do you think better community parks would be good for kids? Yes. And yet those are all things for the most part that are out of the visceral control of the system that we call child protection. They might be able to connect people to those things in some instances, but rarely can they directly impact people's labor rights or wages or housing and food security, which kind of leaves you with this esoteric question of like, would we be better off if we had a massive child welfare, child well-being focused entity with enormous money and ability to actually fight family poverty and do these things? Or is that not likely? And does that mean we need to shrink or limit the power of CPS to hold families harmless from the fact that these things are just out there and exist, and we shouldn't, and we shouldn't expose people to the coercive aspect of it simply because those things are out there? You know what I mean? I don't think I said that very beautifully, but that is sort of the crossroads. It's like, if you don't like the system as it is now,
Yeah.
is the answer to make it much bigger and possibly more helpful, or shrink it and, I don't know what, hope for
Mhm.
maybe more community driven approach to everything else? So what do you think?
Yeah, I think you've captured exactly the fork in the road that we are at right now, given the challenges to, expanding the safety net writ large. I think CPS is this appealing place, especially with Family First, where we can start to funnel maybe some of these resources through. I think that some of the reservations I have with that, again, reflect what I saw in the research in terms of how running this kind of prevention work through CPS, like just the CPS wrapping paper, because of its power, these things that you can't strip from it, its authority, its focus on maltreatment, really kind of colors or sort of taints the sort of support seeking and support experiences that families have. And so, I think one of the talking points that I think that well-meaning reform oriented folks make is, we spend so much more on foster care than we do on prevention. And one of the reasons that talking point always just doesn't quite sit right with me is because that's only true if we think about prevention very narrowly as the prevention work that child welfare agencies are themselves doing. SNAP, food stamps is child welfare prevention or child maltreatment prevention work. Cash assistance is child welfare, child maltreatment prevention work. And so I think that we need to do a better job, making the case, connecting the dots for people to help them see that. And as you mentioned, research on this is coming out and is doing a wonderful job of sort of putting numbers to this, right? How our investments in these areas are child welfare and child maltreatment prevention efforts. So when we invest, this amount in, say, cash assistance, here's what we're actually doing for children in terms of their safety, their likelihood of experiencing abuse and neglect, and of going into the system. And so I would like to sort of make that link clearer for the public so that they see cash assistance not just as sort of an anti-poverty initiative, which it is, but also a child protection initiative as well.
Well said. The book is called Investigating Families, Motherhood in the Shadow of Child Protective Services. Kelley Fong, thank you for joining us on the Imprint Weekly Podcast.
Thank you so much for having me. This is wonderful.
Thanks to Kelley Fong of the University of California, Irvine, for joining us today. And thank you to Listen for sponsoring this episode of the Imprint Weekly Podcast. The Imprint Weekly Podcast is a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at safecampaudio on all major social media. This podcast is produced and mixed by Christine Onjoko, with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you'd consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. We would greatly appreciate if you'd consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is very easy. Just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews and visit us on the web at imprintnews.org. You can get us over email at tips@imprintnews.org. I'm John Kelley, and we'll see you next week.